when we have pain, so many people want relief and they want it now. Is that not always the best avenue to explore?
I think there are problems with that approach. For one thing, it really feeds into our quick fix society, that there is a magic button. You know, you push the button on the TV converter and something happens. Our bodies aren't like that. Our bodies need time to heal when there's something wrong with us. Healing is a process. Healing takes time. Healing needs the right ingredients and the right environment, both mind, body, spirit. Everything needs to be combined there to enhance healing. And usually what we're looking at, and we're conditioned in our society, is to look for drugs. So that tends to be what we think of as the quick fix. The next one is certain injections and surgeries. But let's start with drugs. I wish we had better pain drugs. We have drugs that are excellent for acute pain. So if you break your leg, if you have surgery, opioids are really good for that. But they have limitations when you're dealing with chronic pain. For one thing, people become tolerant to opioids, which means you need higher and higher doses, which means higher and higher risk of inadvertent death. And in this country, the statistic is that about once every 20 minutes, somebody dies of an inadvertent prescription drug overdose, and that's usually contains opioids. Sometimes it's a mix of drugs, but at least opioids are in that mix. And that trend is very disturbing. The United States consumes 50 times more opioid drug, that's all the narcotics, prescriptions, than the rest of the world combined. Wow. So we've grown dependent on those as a quick fix, and they've really failed. When you look at the statistics, and people have had the time to do it now, the idea that they worked for chronic pain was really based on flawed assumptions based on what the research really said. And we now have research showing that as people consume more and more opioids, they actually do less well. They have more pain. They have a new kind of pain called hyperalgesia that's actually likely caused by the opioids. They tend not to go back to work. They tend to have disrupted social relationships as well. So people don't thrive on opioids. The next big class of drugs are the non-steroidal anti-inflammatories. So that's the ibuprofen family, some of which are over-the-counter, which makes people think they're very safe, and some of which are prescription. Well, the statistics on those are pretty disturbing too. For example, I think the statistics are for 2010, 103,000 hospitalizations as a result of non-steroidal anti-inflammatories and 16,500 deaths from those drugs. And to put that in perspective, that same year, 11,000 died from AIDS. So that's a very significant death rate from a drug that you can pick up over the counter. Yeah. Now, the other problem is that they have limited applicability as well in terms of their pain relieving ability. They also slow down healing. So when you're taking a drug that inhibits your ability to heal bone and cartilage, those are, having unhealing bones and cartilage is actually a cause of pain. So maybe you've got a great business model here for keeping customers, but you may not be doing people a lot of good if they're on these things chronically. And then, of course, there's Tylenol, or I shouldn't use that word. Then, of course, there's acetaminophen, the generic. And acetaminophen is the commonest cause of household poisonings. It has a very narrow range between the therapeutic range and when it kills you. So 3 grams a day is considered the maximum dose right now. It used to be 4 grams a day, and I had at a talk, and I did a few years ago, I recommended that people really shouldn't go beyond 3 grams a day because there's some literature showing that. And the next day I got a letter from the manufacturer telling me that they really felt that 4 grams was the right dose. About a month later, they lowered it to 3. I don't think it was because of me, but they certainly were promoting the 4 as long as they could. So that's also got its limitations. Aspirin doesn't have the negative side effects of non-steroidal anti-inflammatories, doesn't cause heart attacks in the way that non-steroidal anti-inflammatories do, but also may have some problems with it too. There's been a lot of research with aspirin and heart disease. The latest recommendations are that it's not recommended for prophylaxis or prevention of heart disease because of the side effect profile. So there's problems there too, but just a general word of when to use analgesics. Is that, can I go into that?
Yeah.
So you use analgesics. They can be utilized intermittently when you need them to recover from an event or possibly to be able to perform what you need to do for an event. But if you're using them constantly, you're also losing touch with what your body's messages are. Now, sometimes you do want to dull those messages, and doing it naturally using turmeric, using cold laser, using acupuncture strategies and liniments and all sorts of other things that we can talk about. That doesn't seem to interfere as much with the feedback mechanisms that the body naturally has. And we do need more research on this, and I want to say that up front. I like to follow the research and do things that are evidence-based, but then we have to look at where the funding for research comes from and what it gets spent on most of the time. There are many things that don't have robust research available, but if they have very benign profiles of side effects, if they don't have a lot of side effects, then I think it's worth trying to see if it works for you. So, the risk you run if you are taking a non-steroidal anti-inflammatory or an opioid and then, say, going to the gym to work out, is that you're going to overdo it, and in the long run you're going to make yourself worse. You're going to miss the fact that a particular type of exercise isn't particularly good for your body, that it doesn't want to do that, and you're going to march right through that. So you're losing some of that information when you take regular analgesics.